Well, I think more important than the treatment options for children is to recognise that sleep apnea can happen at any age, any sex, and it certainly can happen any weight. So often it's thought that sleep apnea is a middle-aged, overweight man's disease. And as a result of that, skinny women don't get diagnosed, young, thin men don't get diagnosed, and often it's overlooked in children. If your children are snoring, if you can hear your child breathing audibly, that is not normal. That is loaded breathing, okay? That is stressing their little systems. And it is not an uncommon thing to have sleep apnea in children. There is an association between immature reflexes to that arousal process that I spoke about before and SIDS. Okay, there is a strong association between sleep apnea in children and ADHD. So, you know, people are getting put on these stimulants. The drugs that their children are given are stimulants. Why are they getting stimulants? Because they're tired, because they have very poor sleep quality. Their sleep is getting fragmented. Now they're ratty during the day. The way children react to tiredness and the way adults react to tiredness is completely different. Children tend to get a little bit erratic in their behaviour, whereas adults will just fall asleep in front of the television. So it is a different problem. But it's very important that we recognise that. And certainly if you've got a noisy breathing child and your child is lying in bed with their mouth open, like this when they're asleep, their mouth breathing. If when they're playing with their toys, they're mouth breathing, that jaw is hanging open, very, very bad. Okay, we need to be nasal breathers. That is the physiologic route of breathing. If you breathe nasally, your jaws will develop correctly. We have sensors inside our nasal cavity that are stimulated by our nasal breathing. It sends a trigger, the genetic development of the jaw. If you no longer breathe through your nose, your jaw will not develop to its genetic potential. You are guaranteed to end up with orthodontic problems, but on top of that, you could have sleep apnea and a lot of other issues as well. So we need to recognise that. And one of the reasons in children that they get this sleep disordered breathing is the fact that they've got these, well, then mouth breathing for one, but secondarily that their adenoids and their tonsils are enlarged. Our adenoids and tonsils are there as to protect us from inflammation and to protect us from disease. And if you have tonsillitis, you've got an infection, they'll get big. Okay, so you're sick. That's quite normal. But if your child is well and you look back there and you've got these big honking tonsils back there closing off their airway, that's not normal. So you've got to ask, why is my healthy child got big tonsils? That is really preventing normal breathing, and that is going to be root cause to a lot of problems that your children will develop down the track. So in children, we can actually help cure sleep apnea by removal of the tonsils and adenoids, but then on top of that, doing a re-education of the muscles through what's called myofunctional therapy, where we give exercises to retrain the breathing. There's a big three that have to happen. If you want to have a normal facial development, you have to have nasal breathing, you have to have a lip seal, and you have to have a proper tongue posture, which is on the roof of the mouth. If you've got big tonsils and adenoids, you can't breathe through your nose, you're going to have your mouth gaping open, your tongue has to be low as a result of that, and the air's going in here. All three are wrong. And now you've learned a whole different system of how you operate. It's the body's best compensation that it can do. The number one thing it needs is an airway. So if you can't nasally breathe, you're going to breathe through your mouth. But that changes everything as far as the development goes. So it'd be really good to prevent these problems of the pain patients that I see and to prevent the orthodontic problems that children develop and the sleep apnea into the future, even if they don't have it now. If they get a good proper jaw development, these should be nice strong structures that support the tongue and keep the airway patent. If they are not genetically stimulated to develop properly, then the only thing that can give in here is that functional space of the airway, and you've got a lifelong compromise ahead of you. That's something that we really can do something about.